Good morning, good afternoon, and good evening. Hey guys, welcome back to the channel. My name is Omer, and I'm a doctor. My passion is to share valuable knowledge that can enhance and potentially save lives. My mission is to empower you with information that can make a real difference in the world. In this video, we aim to shed light on fibromyalgia, providing you with valuable knowledge and understanding. We will explore the common symptoms, potential causes, the diagnostic process, available treatment options, and strategies for coping with this complex condition. Let's dive in and uncover the mysteries of fibromyalgia together. Understanding the basics. Fibromyalgia means pain coming from muscles, ligaments, and tendons. It is a complex and often misunderstood condition that affects millions of people worldwide. It is characterized by widespread pain and tenderness throughout the body. What we know is that people with fibromyalgia are more sensitive or hypersensitive to pain because of increased levels of pain stimulators in the brain. This means that you can experience pain even without an obvious painful stimulus such as injury. Beyond the physical symptoms, fibromyalgia may take a toll on the emotional and social aspects of a person's life. Although it primarily affects women between the ages of 25 and 55, it can impact individuals of any age or gender. Symptoms. Fibromyalgia manifests in a variety of symptoms, which can differ from person to person. Understanding these symptoms is crucial in recognizing and managing the condition effectively. Here are the primary symptoms associated with fibromyalgia. Chronic pain. One of the hallmark symptoms of fibromyalgia is persistent, widespread pain. Individuals often experience aching, stiffness, and tenderness in multiple areas of their body, including the muscles, joints, and even specific trigger points. The pain can be described as dull, throbbing, or burning and may vary in intensity throughout the day. Tiredness and fatigue. Profound fatigue is a common complaint among fibromyalgia patients. Even after a full night's sleep, individuals may wake up feeling exhausted and lacking energy. This fatigue can interfere with daily activities and significantly impact quality of life. Sleep disturbances. Fibromyalgia often disrupts sleep patterns, leading to sleep disturbances. You may wake up feeling unrefreshed, as if they haven't slept at all. Sleep disturbances can worsen fatigue and contribute to other symptoms. Cognitive difficulties, or fibrofog. Many individuals with fibromyalgia experience cognitive difficulties, commonly referred to as fibrofog. This can manifest as difficulties with concentration, memory lapses, trouble finding words, and overall mental confusion. Fibrofog can impact work, studies, and everyday tasks, leading to frustration and decreased productivity. Other symptoms linked with fibromyalgia: headaches, irritable bladder, irritable bowel syndrome, restless leg syndrome, depression, and anxiety. Causes and risk factors. The exact cause of fibromyalgia is still unknown, but research suggests that it can be due to several potential factors. Understanding these potential causes and risk factors can provide insight into the development of fibromyalgia. Here are some key factors to consider. Central nervous system abnormalities. Research suggests that fibromyalgia may involve dysfunction in the central nervous system, particularly in the way the brain processes pain signals. Abnormalities in the levels of neurotransmitters and chemicals responsible for pain regulation, such as serotonin, norepinephrine, and substance P, may produce and amplify pain signals which would normally indicate injury but in the absence of injury. Genetic predisposition. There is evidence to suggest that genetics may play a role in fibromyalgia. Certain genetic variations or abnormalities may increase the susceptibility of an individual to develop the condition. Having a family history of fibromyalgia or related disorders may also contribute to the risk. Physical or emotional trauma. Physical trauma, such as injuries from accidents or repetitive stress injuries, have been linked to the development of fibromyalgia. Additionally, emotional trauma or significant psychological stress, such as experiencing a traumatic event or living with chronic stress, may also be triggers for fibromyalgia in some individuals. The exact mechanisms by which trauma causes fibromyalgia are still being studied. Infections and hormonal imbalances. In some cases, infections, viruses, and hormonal imbalances, such as those seen in conditions like hypothyroidism, have been associated with the onset of fibromyalgia symptoms. Diagnosis. Diagnosing fibromyalgia can be challenging due to the absence of specific laboratory tests or imaging studies that can definitively confirm the condition. Instead, healthcare professionals rely on a comprehensive evaluation of symptoms, medical history, and physical examination to make a diagnosis. Let's talk about the key aspects of the diagnostic process for fibromyalgia so you know what to expect when you go see your doctor. Medical history. The healthcare provider will ask about your symptoms, their duration, and any patterns or triggers that exacerbate or alleviate them. They may inquire about the presence of other medical conditions, previous injuries, or any emotional or psychological stressors that might contribute to the symptoms. Physical examination. A thorough physical examination is performed to identify areas of tenderness and assess overall physical health. The provider will apply gentle pressure to specific points on the body known as tender points or trigger points. The presence of pain or tenderness in several of these points can support a diagnosis of fibromyalgia. Blood tests and imaging may be done to exclude other potential causes of these symptoms. Diagnostic criteria. The widely accepted criteria for diagnosing fibromyalgia are the 2016 revised fibromyalgia diagnostic criteria set by the American College of Rheumatology, ACR. These criteria include a history of widespread pain lasting at least 3 months and pain present in at least 11 of the 18 specified tender points when pressure is applied. Treatment options. The management of fibromyalgia aims to alleviate symptoms, improve quality of life, and enhance overall well-being. There are 3 categories of treatment options. These include lifestyle changes, complementary therapies, and medication. Let's talk about each in more detail. 1. Lifestyle changes. Exercise. Studies show that the best treatment for fibromyalgia is exercise. Regular physical activity can help improve symptoms and overall well-being in a very high proportion of patients. Low-impact exercises like walking, swimming, or gentle stretching and yoga can enhance flexibility, reduce pain, and boost mood. Gradually increasing exercise duration and intensity is recommended to avoid flare-ups. Ideally, you want to build up to do 4 to 5 sessions per week, lasting 20 to 30 minutes each. It may take 4 to 5 months to build up to this level. Stress management. Stress reduction techniques like relaxation exercises, deep breathing, meditation, or mindfulness can help manage stress and alleviate fibromyalgia symptoms. Finding healthy coping mechanisms, such as engaging in hobbies and practicing self-care, can also be beneficial. Sleep hygiene. Establishing a regular sleep routine, creating a conducive sleep environment, and practicing good sleep hygiene habits can promote better sleep quality, reduce fatigue, and improve overall well-being. Balanced diet. Adopting a balanced diet that includes whole grains, lean proteins, fruits, vegetables, and healthy fats can support overall health. While there is no specific fibromyalgia diet, some individuals may find that certain dietary modifications, such as reducing caffeine or avoiding trigger foods, help alleviate symptoms. 2. Complementary therapies. Physical therapy. Working with a physical therapist can help improve flexibility, strength, and posture while reducing pain. Physical therapy may include exercises, manual therapy, and other modalities tailored to individual needs. Massage therapy. Massage can help relax muscles, improve circulation, and reduce pain and stiffness associated with fibromyalgia. Different techniques, such as Swedish massage or myofascial release, may be beneficial. Acupuncture. This ancient Chinese practice involves the insertion of thin needles at specific points on the body to alleviate pain and promote balance. Some individuals find acupuncture helpful in managing fibromyalgia symptoms. Cognitive behavioral therapy, CBT. CBT focuses on changing negative thought patterns and behaviors associated with fibromyalgia. It can help individuals develop coping strategies, manage stress, and improve their overall outlook and quality of life. Heated pool or bath treatment. A study has suggested that patients lying in a hot bath or pool once a day up to 5 times per week for 3 weeks significantly reduced the symptoms of fibromyalgia for up to 6 months following this. 3. Medications. Pain relievers. Over-the-counter pain relievers like paracetamol or nonsteroidal anti-inflammatory drugs, NSAIDs like ibuprofen, may provide some relief for mild to moderate pain. If these do not provide adequate relief, you may require stronger painkillers, such as codeine, from your doctor. Other medications such as gabapentin, pregabalin, amitriptyline, etc. may also be used to help manage the symptoms. Antidepressants. Certain antidepressant medications can help reduce pain, improve sleep, and alleviate symptoms of depression or anxiety associated with fibromyalgia. Some people with fibromyalgia may not fully understand why the doctor is giving them antidepressants. The reason is because these medications can be used to treat other conditions such as fibromyalgia by modifying the levels of neurotransmitters and pain receptors in the brain and hence reduce pain experienced. The name antidepressant is a little misleading as it has many other uses also. Conclusion. Living with fibromyalgia can be challenging, but with a combination of lifestyle changes, complementary therapies and medications, individuals can effectively manage their symptoms and improve their quality of life. It is essential to remember that each person's experience with fibromyalgia is unique. With perseverance and a holistic approach, individuals can navigate the complexities of fibromyalgia and lead fulfilling lives. In addition to the information provided in this video, there are numerous resources available to further explore fibromyalgia and support individuals in their journey. I have listed some valuable resources worth checking out in the description below. And that's it, guys. I try to make fibromyalgia super simple for you. My wish is that this information will be a helpful resource for either you or someone you love. As a full-time doctor, my goal with this channel is to share my medical knowledge with all of you to help improve your overall health and well-being. If you found this video useful, please consider subscribing for more helpful content just like this. I'll be publishing a new video every week, so if you have any suggestions for future topics, please leave a comment below. Until then, take care of yourselves and stay healthy.